Hello, viewers, and a warm welcome to this special episode of your favorite program, Apunar Sikitsak. As we all know, health is the ultimate wealth. But in the kind of lifestyle that we are all leading, we come across several issues and diseases. And today, we have come up with a very eminent and pertinent issue related to urology and nephrology. And so, to discuss more, we have amongst us renowned and eminent urologist Dr. Arup Kumar Nath, Chief Consultant and Urologist, Institute of Urology and Kidney Diseases, which is a super specialty hospital coming up in Sonapur, Guwahati. And besides that, he is also the Chief Urologist of the currently running Advanced Urology and Kidney Diseases.
Stronger energy, because see, I am doing at 55 watts now, but for almond layers of tissue, you need at least 80 to 100 watt energy. So, and that energy creates a very strong bubble, and that evaporation of water and collapse of the bubble. That is the here, see, pyronizer is not nothing much, but if you try the almond here, then you have plan, false plan.
So, welcome you, Dr. Nath, to the show today. Talking about belief and commitment from the doctor's end. Dr. Nath, we also know that there are very rare cases that you have conducted. So please share with our viewers on certain such incidents of cases. I've recently read in the newspaper that a 12-year-old child was operated upon.
Yeah,
and then
12 day.
12 day old. Yes.
12 day. So it was a like birth defect. So the kid could not pass urine. Urine gets accumulated in the bladder and the kidneys, and gradually that will harm the kidneys. So the detected while the baby was in the mother's womb by doing ultrasonography. Nowadays the investigation facilities are now very up to mark even in Guwahati. So we can pick up so many congenital causes beforehand, before birth itself. So after that the baby got birth in a big center. So the pediatric doctor, he wanted me to see the patient because it's such a small kid. When I saw, he was only 9 days, so he needed immediate intervention, immediate surgery. So I asked the parents to come to our place because we needed to do it laser, which is not available at that center, thulium fiber laser, which is the only most advanced laser available at our place. We installed 3 years back, but still this is the only machine in Northeast. So with that laser we did the surgery, and we did as a daycare. The baby came in the morning on empty stomach. We operated at very early morning because keeping the baby empty stomach is very difficult. So we used to operate these kind of cases very early in the morning, and the same day by evening we discharged the patient. Now he is passing urine, the kidney swelling has gone. So this is a very challenging case for us, and we could give the result by laser surgery. That gives lots of satisfaction. Okay. Then one more case, when I was working in another hospital, maybe around 5 years back. It was at that time 1 year, 1 month, 28 days baby. By that time we operated to 2 months, and we removed half of kidney because it got damaged, and there were lots of pus collection, and the baby had fever, continuous fever. So we needed to operate, and we needed to take out that part of kidney to save the rest of the kidney. The normal thing was like we needed to otherwise we needed to remove the kidney, but we decided to go ahead with saving the kidney. So doing a partial nephrectomy, that is removing half, that too laparoscopically in a 2-month baby. It was very challenging. And at that time when I searched the literature, this was the youngest case even in the world to undergo that kind of surgery.
Okay.
But we operated, and by the grace of God and the help of my team and the belief, the party, they were from Arunachal, and they said that sir, I said that I did not operate laparoscopically in such a small kid with for such a big surgery, but they said no, doctors at our place said that Dr. Nath will do this, and you have to.
That is commendable of you, Dr. Nath. And besides that, I think not just in nephrology, I've got the review from one of your patients too that there was some delivery case in the train or something. Running train was it something?
Yes, yes.
Could you share about that incident?
It was again a very when I look back, it was like very, very satisfying to save the mother and the baby in a moving train. And we were traveling to one of our peripheral outreach camp in Barak Valley by train. So the train reached in Ansi Hills, inside the jungle, around 100 kilometers from Lamding. So at night around 1:30, I got a call that someone is searching for me in our bogie, and the shaker came, the TT. He came and he said, Dr. Nath, you need to come to some other bogie where a lady is in labor about to deliver a baby. At that time, it is
something away from your
something
field.
away from my field,
Yeah.
and because you always travel with my team, so my technician were there, my assistant doctor was there, so we rushed to. I did not think. At that time, there was no time even to think that yes, as a doctor, I need to help. So we rushed to the bogie. Then with the primitive thing, we conducted the delivery, and the baby, we could save the baby and the mother. Even it was such a memorable thing that train halted. Because someone said that something of this like kind going on. They thought that maybe we need some medical help, and the patient may have to be shifted to some nearby hospital. But at that time they could feel that it is inside the jungle and in the Ansi Hills, so it is not possible. So we decided to go ahead even in the bogie, and somehow we could do it, and the baby safely we could deliver.
Maybe that is why it is said that after God, it is doctors that the common man looks up to. That is the reason why, maybe. Yes,
but it was a little risky also.
Yeah.
But somehow we could conduct it and safely. And in the morning at Badarpur, the mother and the baby shifted to a hospital.
Okay, commendable of you, doctor. Okay, doctor, now coming to your specific field, like use of laser in uro and nephro related issues. Now, you are also known as the forefront runner in the Northeast who has introduced laser in urology related issues. So please share with our viewers more in depth about this.
Actually, laser is a technology. So as a surgeon, it is just like another technology. So it was not there when I landed in Guwahati. It was there in India in some premier institute. Started in the year 1998, I think. But till 2011, when I landed, it was not there. So I decided, I asked the hospital authority at Downtown Hospital, and they were very kind to provide me.
They're open to your new innovative
ideas. It was expensive at that time. They installed that laser, and we started giving the good result to the patient. Afterwards, I bought myself another 3 more lasers. Now we have 4 lasers for specific diseases, and I can say that this is the only center, our advanced urology and kidney disease in India, to have 4 different lasers for different diseases. It is a technology, as I have said. It has lots of advantages, because if we operate with laser, like stones we can operate, and like bladder cancer, prosthetic diseases, we can operate. Kidney stones, advantage of laser is we can do as a daycare. The more a patient coming in the morning, they can go back in the evening to their place, cutting down lots of expense and hospital stay. The convenience, it is very, very convenient also, because patient coming in the same day and going back. And for soft tissue like prosthetic diseases, laser has lots of advantage because it is nearly bloodless. So a prostate problem, prostate hypertrophy problem, mostly it occurs and the surgery is required in the 70s or 80s or 60s. All those male patients have like diabetes, hypertension, then the obstructive airway diseases, lots of pulmonary issues. So when we evaluate for operation, like they may take also like blood thinner, which again will lead to lots of bleeding while operating. So lots of things we need to consider while operating. So convenient technologies sometimes become risky, and people need to stay for 3 to 4 days in the hospital. So elderly people staying in the hospital again is a risk also, because there are some chances of cross infection, hospital acquired infection. So laser cuts down that.
Okay.
No bleeding, blood transfusion is also not required. That way it helps. Like for bladder cancer again, it is bloodless, and we can send the patient back same day.
So you've got
lots of
proven
things.
results
Yes,
quickly,
yes, yes.
sir.
Now, like because we are doing specific things, and now gradually I am doing mostly the laser cases. Now I am invited to lots of different places in the nation to go and to demonstrate live in their conferences, which is very new for our place, because earlier people from outside, like mainland India, they used to come to our place to showcase their skill in live operative workshop, which is being held in our place also. Even I held 3 conferences of that kind, but people from mainland India asking us to go there and showcase our skill to them is very rare.
Yeah.
And
And Dr. Nad, do you also plan to introduce this in the to be open new IUKD hospitals?
yes,
Super
definitely.
specialty?
Even after laser, we may think of going for robotic surgery also. That is
Okay.
one field. We do not have urological robotic facility at our place, so that also we are planning. So like kidney transplantation, robotic surgery, and urological subspecialty. That will be our aim in the upcoming hospital. And as it is in the periphery, it is outskirt of the city, because what I felt by working in the big cities, when a patient comes, they need some space. There should be some natural element also in the healing process. It should be little spacious, because because all the patient now comes in their own vehicle, and hospitals in the cities, they have like space constraints. They do not have enough parking places also. So with all that idea, I purchased that land in the outskirts, and then it is a little naturally rich area in the hilly backdrop, and because I have already said that if a patient comes for kidney transplantation, they needed to stay for long. So in our campus itself, we are planning a low-cost guest house, so that patient can stay in the campus, and the patient can be visited by doctors or our paramedical staff without being transferred the patient from one place to another. They can stay in our low-cost guest house. We are planning a multi-brand food joint also, so that the attendant also will can benefit from the facilities there. And we are planning a nursing college, and those workers, because for success of a hospital, the staff like sisters, the ward boy, OT technician, they are the people who work day in and day out behind the scene. Because you congratulate me for conducting a surgery, but the whole credit is not limited to
team
me.
effort.
Yes, those people like OT staff, OT nurses, they stand there for hours. They work very hard, selflessly. Sometimes a sister whose duty may be ending at 8 p.m., they may need to work up to 12 at midnight, maybe 1 a.m. without any complaint. So lots of sacrifice by lots of people in one successful surgery, or in one successful hospital. So lots of people are there. So we are thinking for them also. We are planning to have a like facility for them to stay in the campus itself. Okay. So we'll be having those quarters also, but gradually one by one. Now we'll have this hospital. This will be first of kind, like urology nephrology facility in Eastern India, you can say, and even in the whole country only 4 or 5 hospitals like dedicated urology nephrology hospitals. So we are working on that line, and because as you have already said that what you are doing to reach to the people in the periphery. Now like in our outreach camp also, we are going to the district place, or maybe little interior to that. We are not going up to the village or something like that.
Also, doctor, I know that you are a great yoga enthusiast, and for the natural healing process, yoga of course plays a great role. Recently you were also awarded the Yoga Sadhak Award, right? And congratulate you for that.
Thank you.
So, doctor, you please let us know, like, what kind of a role yoga and such natural, like, healing techniques do they play in?
See, the disease itself is a manifestation. So, some part of our body is not working well, or in some part there is something which is not required, like a kidney stone, maybe a cancer, or some joints not working. So why that happens? It happens because of our bad habits, because of our bad food, because we do not exercise. We are used to our sedentary habit. So these are the things, because the more killer diseases are now the lifestyle diseases.
Absolutely.
The infective or infectious diseases has gone by the ambitious project and plan by the government. Nowadays you do not get malaria, diarrhea, killing patient, which were the used to be condition maybe 3, 4, 5 decades back. Now we do not have infectious disease killing people, like virus still there, but other infectious diseases almost gone.
Yeah.
But now the lifestyle diseases like diabetes, hypertension, arthritis, cardiac diseases,
It's mainly
all
because
those
of people's bad habits,
people,
we can
bad
say.
habits, bad lifestyle, bad your food, and at the same time the addiction.
Absolutely.
All those the dangerous things like alcohol, tobacco, there's bad habits again helping it. So if we take care of our body, our food, our lifestyle, little exercise, yoga, then definitely helps. Like yoga, you can say it is a like promotive kind of treatment, and our allopathy is a curative kind of treatment. So if we add both yoga to allopathy, then it may become preventive.
Yes.
So we can prevent disease.
Yes.
So it is yoga is promoted, because see, while doing yoga, different asana, pranayam, mudras, what you do, you move the body, like your body becomes agile, the joints, you take care of the joints, the lungs, and those muscles, and all the like vertebral
Overall
column,
body.
everything.
Yes.
So by doing simple yoga, because you do not need any like fancy machines, like maybe like in the gym you need lots of fancy machines, and you need to spend. But here yoga, only a yoga mat.
Process.
Yes, you need a yoga mat. So I can say that this is the best gift of India to the entire
To the world,
to
actually.
the world.
And
Now,
do you also preach the practice of yoga amongst your patients?
definitely yes, because myself doing for last 4 years or so, I could see the change in myself.
Okay.
So I always advise my patient who needs it that you can concentrate on yoga. At least sometime you give to your body, because you are to the mind you are giving maybe 12 hours or 10 hours a day.
Yes.
So for the body you can give at least half an hour.
Yeah.
And if you do yoga like I do in the morning at 5:30 a.m. in the morning, that makes your day very enjoyable, very beautiful.
Yes.
And you become enthusiastic
Yeah.
and ready for the day. And by doing yoga in the morning, what you do, you wake up in the morning.
Yeah.
So if you wake up at 5, your day is 3 hours added to your day.
During that Brahma Muhurat that we said.
Muhurt.
Yeah.
If you do yoga, and to wake up at 5, you need to sleep at around 10:30.
Absolutely.
So you are not wasting those useless moment from 10:30 to 12 by seeing the mobile or the television. So that time you are using in the morning. So for your life, every day you are getting 2 to 3 hours extra.
Yes.
Those people say I do not have time to practice yoga, so this is not the thing.
It's not
So
an
if you
excuse.
wake up early, you get 2 hours extra per day.
Yes.
Institute of Urology and Kidney Diseases. In short, IUKD is the first kidney-related super specialty hospital in northeastern India, based in Sonapur, Guwahati. Under the supervision of eminent urologist Dr. Arup Kumar Nath, IUKD is the modern-day healthcare hospital with various facilities related to kidney diseases. All kinds of laser technology in urology and nephrology related issues are available at IUKD. For the healthcare services and facilities at IUKD, we can be reached at 98641 04444 and 88227 21671.
Okay, now Dr. Nath, coming back to IUKD. So for patients, to deal with issues related to urology, nephrology, so what kind of treatment facilities can they expect from this super specialty hospital coming up?
So, as I have said, that there will be subspecialty care for urology, and even for nephrology, we will have like pediatric nephrology, then transplant nephrology, the regular nephrology, dialysis facility will be there, and transplant will be started in a year or so. We need to fulfill some criteria, and the concerned authority will visit our place once we start functioning the hospital. Then they may give us the permission, but we are planning accordingly. We are planning like dedicated transplant operation theater, then transplant ICU we are constructing separately. Then there will be ICU facilities also, and at the same time, as I have said, there is a big parking space and lots of green gardening also we are keeping.
Okay.
So
guest house
facilities will be there,
also
doctor
will be
staff
there.
quarter. So in a campus, people will be getting all the facility in the years to come.
Okay. Could you also elaborate on your team of doctors, like with their specialties, subspecialties that would be available in the new hospital?
Yes, as I have said, that 2 more urologists are working with me, and one of them concentrating on urological cancers, other in male urology, the male sexual problem. These are the things earlier not addressed in our place, but our urologist now concentrating on that. Also, myself concentrating on lasers, and three to four urologists will be joining our team once the hospital starts, and they will be concentrating. One will be on kidney transplantation, one will be on reconstructive urology, and one urologist will be concentrating mostly on academic, because the academic things are the like the thing, like you can say, the ornaments.
Yes, that needs to be
strong.
Yes,
it needs to be strong, and we are planning that we should in the years to come, in the time to come, we want to develop guidelines for not for India, for the world.
For the world. Okay.
Because we will work in that line. That what we will be doing, we want other people to follow. Okay. Like people are going outside, still people are going outside. We want people from not only from India, we want people from our our Southeast Asia or even the world to come to get our to seek for our service in our place. Okay. So our idea is that. So initially we are starting with 6 to 7 urologists, but I am very thrilled that in the years to come will be 20-25 urologists, 10-15 nephrologists working day in and day out. So in that scenario, what happens that one urological surgeon will be doing only one surgery, so he can master it, like he can be authority in the world. So that is the thing, that is the ambition. Okay. I am having. And as I have already said, that in our place we have a very healthy working relationship with each other. We help each other, and our aim is to develop on ourselves.
Okay. So also, doctor, with the full functioning of IUKD in Sonapur that we are expecting, with the currently running advanced urological kidney diseases centers, so what about these centers? Would they still be functioning, or how would be their rate or pace?
Definitely, because when I started, it was just one center in Guwahati. Now I am visiting 20 places, and my co-urologist, again my senior urologist, he is visiting nearly 25 places, Dr. Anup Kumar Dattabarwa, and even I'm amazed to see his energy and enthusiasm, dedication towards the patient. And another urologist, Dr. Basha, he is also moving to lots of places. When we come to Sonapur and the institute starts, definitely we'll have other challenges and we need to work there little more time. But as I have said, that another 3-4 urologists will join us. So definitely we'll continue going to the peripheral places where we are working right now. And this center at Bhangagar will continue because it will help the people from the city to meet us here. And at Sonapur, definitely it will be 24 hours urological availability.
Okay. Also, I have read of this concept of Sky Clinics and online counseling for patients. So could you elaborate on this?
So after the COVID pandemic and the great initiative by the Honorable Prime Minister Narendra Modi ji that we should go digital. And even WhatsApp, he has made it official that by WhatsApp you can share things. So what happened, it entered in healthcare also, and we are getting the benefit. Lots of people earlier used to say like, I am having this, I am having that, and because the medical terms are a little difficult, not regular terms, so people always struggle to actually communicate with us. But nowadays what they can do, they can just take a photograph of the investigation and send to me, and this symptoms also they can share. It makes our job very easy. Then I thought, why not we give online consultation. People are giving online consultation even from outside Assam also, but our concept is a little different. We are developing this Sky Clinic in the periphery, not like in the city like other people giving online consultation. It is in the periphery, maybe in a village where there is maybe a pharmacy. The pharmacy people can guide the patient, so or maybe a laboratory. So it is located in the periphery. So when they contact with us, when we set up the Sky Clinic, we share numbers, they also share, and we also share. When a patient comes with a complaint, they first WhatsApp the reports on the complaint, and 5 to 10 minutes time our urologist is available for video consultation. So lots of enthusiasm and encouragement we are getting.
Internet facility
With
so
internet facility
available, it becomes easier.
And what I could feel that people are very happy with this, because for 1 year from now we are giving the video consultation free of cost to the people of Assam and Northeast. Even that day I had a video consultation, this Sky consultation, even from Siliguri. So it is so fulfilling and so satisfying that even by sitting here,
by not being
I could
there
help
right
him.
in front of the person, you're fulfilling their needs.
Yes. I could help the patient in Siliguri. So it gives lots of satisfaction, and it was a brainchild of me and my colleague urologist. But as it is, I think it will definitely be helpful to the people, and lots of people are coming up. We are setting up lots of clinic like that, and I want interested people to contact us.
So
IUKD.
could you, at this stage, I would like to ask you, is there any specific number that you can share with our viewers kindly?
Actually, in our prescription also, I give my number first, so that people can first hit me before the others. So I make myself available. As a doctor, I have that responsibility to the patient. So my number is the first in the prescription. So again, I am sharing. My number is 8011501833. 8011501833. This is my number. Then another number 98641044444. 98641044444. So for anyone who wants to set up a Sky Clinic, definitely can contact us in this number. It will help the peripheral patient, because they are not moving to the district places or maybe the capital here to meet us by spending maybe in thousands.
This would be really helpful for the
and even they can save lots of time also. Because you see, 70 to 80% patient which we are consulting on day-to-day basis, they need only the medical treatment. Surgical treatment is required by only 10 to 15% patients. So that 70% patient, if we can treat at the periphery itself, it will save lots of time, it will save lots of money. And what we could feel that a patient, while coming to us, has already spent a lot. Then our consultation, after that they do not have the money to buy the medicine, and they go ahead with the investigation. Now, as we are giving our consultation free of cost, and they are not traveling, so that 3,000 to 4,000 rupees they may use for the investigation, the required basic investigation and the treatment.
So this will be a boon to the patients actually. Free counseling
and
consultation.
Yes, definitely hope so. And those interested can contact us in this number to set up a Sky Clinic at your periphery, help the people, and even they will get the help, the investigation laboratory or the pharmacy, because they will purchase the medicine or will undergo the investigation at their place. So definitely even they will also get economically benefited.
Yes. Thank you so much, Dr. Nath, for sharing so much about everything related to urology, nephrology, and also besides that, viewers, This is a great opportunity with Institute of Urology and Kidney Diseases coming up. So with that, it will be a great boon to the entire society actually to avail for any kind of issues. So thank you so much, Dr. Nath, for this entire discussion today, everything. And viewers, we really hope that you love the discussion and you're hopeful to come up with more issues. And thank you so much for watching the program.